This is the view of the skull from the bottom, from the bottom. So this is the big opening, the foramen magnum, through which the spinal cord passes, like so. So the spinal cord will go in like that. Okay. Then on two sides are your condyloid processes, which will articulate with. On two sides are the occipital condyles. Occipital condyles will articulate with the atlas. Remember the atlas, the C1, vertebral bone 1. They will articulate, these occipital condyles will articulate with the superior articular processes of atlas, forming the atlanto-occipital joint. So there's your foramen magnum, occipital condyles, and then you have here, this is the occipital bone, but on two sides are two openings on two sides of the occipital bone. Those are called the foramen lacerum. Foramen lacerum, if you can see here, through which blood vessels pass through. Foramen lacerum. Then you have openings here and here as well, which are called the top one here is the carotid canal, and the bottom the jugular fossa. And then here openings that lead upward into this. This is the maxilla. The maxilla and the palatine process of maxilla here. So you can see that line separating them. The line in here is the intermaxillary suture, and there should be another opening. So you cannot see here in this drawing. This is the mandible. So they kept the mandible here but removed it here. So there's an opening in the maxilla that's called incisive foramen. Intermaxillary suture, palatine process of maxilla, and then that is the vomer. Those openings going in, those are called the conchae. Okay, so like this, spelling concha or conchae, plural. Okay, and then here extensions of this palatine process are the pterygoids. So the pterygoid, I will show you a simpler diagram, but here this would be the lateral pterygoid lamina, lateral pterygoid plate, medial pterygoid plate, and the little hamulus. Okay, there, medial pterygoid plate, lateral pterygoid plate, hamulus, lateral pterygoid lamina. Okay, and then there's two openings over there just below the lateral pterygoid plate here. The first one closest is the foramen ovale. The next one is the foramen spinosum. Okay, and here you can clearly see the zygomatic arch. Okay, there is zygomatic arch here. This is the zygomatic bone, then the arch. This is the temporal region. So let's find the mastoid bone here. The mastoid bone is this structure here. Okay, here is it on this side. There, sticking up, are the styloid processes. Styloid process here and here. And you cannot see the external auditory meatus from here. You will have to look at it from the side view. So as you can see in this drawing, I have not included the mandibles at all. So here is your maxilla, palatine process of maxilla, incisive foramen, intermaxillary suture. Conchae leading there, vomer. Again, vomer forms one portion of the nasal septum, the other was ethmoid bone, and the other was septal cartilage. And then we will zoom in on these pterygoids in a second, but here you can see that's the styloid process, foramen magnum, occipital condyles, jugular fossa, carotid canal, and then here on two sides, external artery meatus, mastoid bone, and then here this is the occipital region, there's the occipital crest and occipital protuberance. Okay, now we will just zoom in on that pterygoid region. So here it is, and looking at it, here's the maxilla, palatine, incisive foramen. The palatine continues down, there's the vomer, and then forms the medial pterygoid plate, lateral pterygoid lamina, hamulus, lateral pterygoid plate. So there, lateral pterygoid plate, medial pterygoid plate, hamulus, lateral pterygoid lamina. And then curves up, and there's two openings. The other one is hidden behind this structure. That is the foramen ovale, and the one behind this, the next smaller one, is this foramen spinosum. Okay. Finally, I just made a quick simplified diagram of the structure inside the orbit. So here we have the top of the eye. This is kind of that eyebrow area here. This is the frontal bone, the forehead, zygomatic bone, zygomatic official foramen, infraorbital foramen. The supraorbital foramen is either like so, by itself, called supraorbital foramen, or it can be like that. so it's continuous with the orbit, attached to the orbit. That's called supraorbital notch. Some people have a notch, some people have foramen, some people both. One eye has one, the other one. Then nasal bone, the opening into the nose. There's a septal cartilage. Nasal septum. Septal cartilage is just the front portion of it. Okay, maxilla here. I tried to shade them different colors, but I'm only using a pen, so I can't. So this is the maxilla area, maxillary area. And here, you see the frontal bone goes into the orbit and forms the top portion of the orbit. Okay, it's continuous, the frontal bone. Maxilla also goes in, forms this part of the orbit. Zygomatic bone also goes in, forms this portion of the orbit. So you can say orbital surface of zygomatic bone, orbital surface of maxilla, orbital surface of frontal bone. Okay, the bone that is most to the side of the orbit, to the medial side, is called the lacrimal bone. The lacrimal bone has a nasolacrimal fossa. It's like a groove, and inside the groove lies the lacrimal gland, which produces the tears. Okay, your eye would be here, and the lacrimal gland sits here. Then you have this bone here, that's the ethmoid bone. The ethmoid bone has two openings called ethmoid foramina. Foramina is plural, foramen is singular. Between the orbital surface of maxilla and orbital surface of zygomatic, this is about the rough estimate of their location. Here is the inferior orbital fissure. Superior orbital fissure is here. This is the inferior orbital fissure. And then the superior orbital fissure and the optic canal through which the optic nerve passes. We'll talk about what passes through, for example, these guys here when we talk about the neuroanatomy. But for now, inferior orbital fissure, superior orbital fissure, optic canal. So this lies between these two, maxilla and zygomatic bone. The superior orbital fissure lies between, and the optic canal lies in the sphenoid bone, the orbital wing of sphenoid. There's I drew outside here the great wing of sphenoid, the orbital wing of sphenoid. There's the superior orbital fissure and optic canal. Okay, so that's all. I hope this was helpful.